Tonight in Healthy Living, what's wrecking the romance in your life? It may be the pills you take every day. Turns out some prescription drugs can ruin your sex life.
I mean, lots of passion, lots of calling into work.
Okay.
Jessica and James Pesh fell in love fast and married just months after their first date.
We ended up getting pregnant a month after we were married, so.
Raising their son Jace and building their personal training and nutrition business demands all of their time. When Jessica began suffering severe mood swings and depression, a doctor prescribed an antidepressant.
I noticed right away I didn't have a sex drive.
Antidepressants aren't the only drugs that can cause you to lose interest in sex. Anti-anxiety meds, diuretics, blood pressure medicine, muscle relaxers, even antihistamines can cause this unwelcome side effect. Pharmacist Renee Quaderas encourages patients to read up on side effects, but you won't find sexual side effects on any warning labels.
Of all the side effects you can experience to drugs, it's not normally one of the most common.
She says talk with your doctor about options. You might be able to reduce the dose or even take a drug holiday.
Which is where you actually go off the drug for a time and then restart it, and sometimes side effects will not be experienced the second time around, or else they will subside and you'll have better luck next time.
Might even try a different medication.
I think doctors are sometimes embarrassed to bring this up to the patients. They get kind of focused on high blood pressure, heart disease, depression, and they're not really thinking of things like sexual dysfunction.
Scott Litwiller specializes in treating sexual dysfunction. He recommends talking to your doctor. If changing meds isn't an option, you may want to try medications that help boost your desire. Dr. Litwiller warns, just be sure to rely on proven medications.
There are a lot of things that are out there on the internet that people will look up that don't have a lot of good medical basis behind that. And so you want to use medications that are really well studied and approved for those kinds of things.
230.
Jessica had talked with her doctor.
She basically told me that women don't have sex drives when they're have families and careers, so I need to just make time to have sex.
She rejected that doctor's advice and got a second opinion. Her family doctor found a serious thyroid imbalance was causing her mood swings, and she stopped taking the antidepressant. 2 months later,
I wanted to have sex again for the first time in like 2 years, and now I have those feelings again, you know.
Doctors and our couple in the story insist you have to be your own advocate. Read up on medications and find out if it's the med or your medical condition that's affecting your sex life.